Hello and welcome to Insurance 101, an overview of SWWC's benefits and insurance offerings and explanation of the accounts that go with our plans. A copy of this presentation is available on SWWC's employee portal at www.swsc.org/insurance101 so that you can open the handouts as needed. This page of the employee portal is not password protected, so you can share the link with your spouse and parents if they are assisting you with your insurance enrollment decisions. There are three 101 handouts available on the resources page of the employee portal: Benefits 101, Insurance 101, and Pay Stub 101. While I'm always happy to assist you with any questions you may have about your compensation, benefits, and insurance questions, these tools can also provide some quick answers for you. Pay Stub 101, also available on the payroll page of the employee portal, explains all of the items that you will find on your paycheck, from gross wages to net pay, including income tax and FICA, your pension plans, TRA or PERA, employer paid benefits, and employee deductions. SWWC offers a wide variety of benefits, many of which are insurance, which I will cover later, but there are a large host of other benefits as well. This handout is also available on the benefits page of the employee portal. The first section is a repeat of the employer paid benefits that show up on your pay stub: SWWC's portion of FICA, contribution toward TRA or PERA, 403B match, life and LTD premiums, SWWC contribution toward health premiums, and the VEBA and/or HSA, and finally, SWWC's reserves for paying unemployment claims and our workers' comp insurance premiums. Next, we have our other insurances that employees have access to: group rates on dental, vision, and dependent life insurance through Delta Dental, Emeritus Vision, and National Insurance Services, which are all deducted from the employee's paychecks. There is also the access to a long-term care insurance through ASHA, though those premiums are paid directly to the carrier by the employee. TRA and PERA are explained again in a little more depth, as they are on the Pay Stub 101 handout. We offer to all staff a 403B plan, which is also known as Deferred Compensation or TSA, which stands for Tax Sheltered Annuity. For those familiar with the private sector's 401k, this is the public sector version. It is a way to save money either pre-tax, which is the traditional version, or post-tax, which is the Roth version, into one or more accounts that can be invested via a financial planner to be saved for retirement. We have a list of approved providers available at www.swsc.org/403B. You can work with any financial planner you would like, as long as they work with a provider on this list. There is no enrollment period for this plan, so you can sign up at any time, and all employees are eligible to participate regardless of part-time versus full-time status. Those who qualify will also receive matching funds once they are eligible, according to their bargaining group language. Much more information is available on the benefits page of the employee portal regarding this excellent retirement savings tool. Doctor on Demand is a way to visit a doctor using your smartphone, tablet, or computer, saving you time and money. A 10-minute visit, which is often longer than you may see a doctor in person, starts at just $44. There is also mental health treatment available. All of these visits apply to your deductible and can be paid with a VEBA, HSA, or FSA funds. Vitals is a tool to assist staff with becoming a better consumer of their health costs by providing comparisons in cost, quality, and convenience of office visits, lab tests, prescription drugs, and more. Employees even receive an incentive check for choosing a cost-saving provider. The Employee Assistance Program, abbreviated as EAP, offers help with a variety of life and work stressed situations, including relationship issues, work pressures, alcohol and chemical use problems, loss and grief, depression, financial crisis, parent-child conflicts, and much more. Our EAP is offered through the Sand Creek Group, which has an excellent website with a host of resources, including a legal and financial library and monthly webinars. There is an 888 number that can set up assessment and referral counseling for you and your dependents at no cost to you. Up to 3 in-person appointments are included per episode. This benefit is completely confidential. SWWC never receives information about who is using the services, and you can choose from a variety of counselors in your area or in another town if you prefer. The crisis line is available 24 hours per day, including holidays and weekends, and is staffed by highly trained, experienced, and licensed counselors who hold at least a master's degree in psychology, social work, or other related behavior health sciences. Do not hesitate to use this benefit. Your well-being is important to us here at SWWC. In addition to the VEBA and HSA, employees also have access to FSAs, or flexible spending accounts, to set aside pre-tax money to pay for medical, dental, and vision bills or daycare expenses. It's important to remember with FSAs, if you contribute to an HSA, you can only have a medical FSA for limited purpose, which is dental and vision only. Also, FSAs have the use it or lose it provision, which means that expenses must be incurred by the end of the plan year, which is July 1st through June 30th, or they will be forfeited. Moving on to the second page of the handout, we have 2 other insurance resources. Blue 365 Deals is a discount website for those on our Blue Cross Blue Shield health insurance for items like health monitors, hearing aids, and more. Trig is an educational website that gives you knowledge and tools for how better to use your healthcare system, including information on how to choose your provider, when you should ask for a second opinion, and more. The next item is paid leave and holidays. The paid leave includes sick leave, personal leave, annual leave or vacation, and emergency closing leave, which only applies to the DSS group. Remember to utilize your leave codes handout available on the payroll page of the employee portal to help you determine which leave is eligible for a specific absence reason. Your group's personnel policies or master agreement, as well as your summary of benefits, will explain your leave benefits in more detail. Some bargaining groups are able to be reimbursed for dues or membership fees when they are part of a professional organization. The maximum amount is determined by the bargaining group language, which can be found in their personnel policies or master agreement. SWWC carries commercial general liability, automobile liability, and umbrella liability to cover all of our staff. Cell phones are another benefit for those who require one for their position. SWWC offers the option of a company cell phone or a stipend to assist with paying for one's personal cell phone plan. Company cars and mileage reimbursement are another benefit offered. For those who drive enough miles, a company car may be provided. Everyone else has the opportunity to submit their business purpose mileage for reimbursement at the standard IRS rate, which is paid through payroll. COTAs and PTAs have the opportunity to submit up to $120 of their cost for their license. Professional development awards, including the Senior Fellows Award, require an application process for approval. See the benefits page of the employee portal for more detail. Certified staff are eligible to request a lane change based on the higher education courses they've completed beyond their current salary schedule placement. Eligible staff must submit a course credit approval form for each course that they want to have applied toward a lane change prior to taking the course. SWWC's Board of Directors approves lane changes 2 times per year. The lane change approved at the September board meeting is effective for the whole contract year, and the lane change approved at the February board meeting is effective from February 15th through the end of the year. If this applies to you, you are responsible for letting your supervisor know when you are eligible for a lane change and will be required to submit proof of completion via your transcripts. SWWC has their own continuing education committee for certified staff and administrators to submit their 125 clock hours of teaching and/or administrative hours to be submitted for licensure renewal. Contact HR at swwc.org to learn more about how to submit your hours to the committee. Based on budget and whether or not the supervisor finds that it's appropriate for the requester's position, SWWC may pay for expenses related to attending workshops and conferences. Employees should submit a workshop request form through AppleTrack to gain permission to attend. SWWC employees have access to a few different discount programs: Dell for the purchase of computers and other technology for personal use, Enterprise for discounted car and truck rentals as well as used car sales, the fitness discount program for those on the health insurance, which gives you $20 off your monthly gym membership if you go 12 times or more per month, and the Verizon wireless discount, which is up to an 18% discount on your cell phone voice services and a 25% discount off select accessories. SWWC has an employee advisory committee whose members make recommendations to administration on staff development, insurance, and wellness. They also serve as our safety committee. In addition to any wellness activities planned by the advisory committee, we also offer annual flu clinics, biometric screenings, wellness newsletters, and a page of our employee portal designated for wellness resources. The last 101 resource is the Health Insurance 101. This one does not explain our insurances, but is rather a list of common terminology you find in insurance, such as CDHP, deductible, EOB, copay, and more. You can read through it after watching this webinar and let me know if you have any questions. EaseCentral is the online enrollment site that SWWC uses for insurance enrollments and FSA elections. New hires have 30 days from their hire date to enroll in our group insurances. All insurances are effective the first of the month following your hire date. If you start on the first of the month, your insurances are effective that day. Each new hire will receive an email with an @swwc.org email address with your EaseCentral login link. This same website is also used for annual open enrollment, which is effective July 1st of each year. Information is sent out each April regarding this opportunity to make changes to your current insurance enrollment, including changing plans and adding or removing family members from your coverage. If you have a qualifying event arise, such as birth of a new baby or involuntary loss of other health plan coverage, you have an opportunity to make mid-year coverage election changes. This must be done within 30 days of the event, so please make sure you take care of it as soon as possible. If you miss this deadline, you will have to wait until the next open enrollment to make any changes. Detailed instructions for EaseCentral can be found on the insurance page of the employee portal. In the new hire or open enrollment email, click on the login link in the blue box at the bottom of the email to get started. For new users, your name and email will be populated on the EaseCentral login page. Create a password based on the requirements shown, retype it for confirmation, view the terms of service and agree to them, and then click Sign Up. For subsequent logins, just type your email and password in the Click Login, and then click Login. If you cannot remember your password, click the I'm unable to log in link, and the instructions will be emailed to you to reset your password. If you are still having difficulties logging in, please send an email for assistance. For new users, click Start Enrollment to start the process of signing up for your insurance. Other options available on this dashboard are Document Library, where you can view forms and other handouts about insurance, Manage Benefits, where you can view your enrollment summary to see what plans you are enrolled in and/or start the process of making qualified event changes, and View Profile, where you can view your demographic and contact information. To return to this dashboard at any time, click the dashboard link next to EaseCentral at the top of your window. The Help link will give you contact information for insurance questions at SWWC. You can change your password on the Settings menu found under the drop-down, viewed by clicking on your name in the top right corner. Please leave your email as your SWWC email. You can change your username if you'd like, and you can update your mobile phone if you wish to log in to EaseCentral on your cell phone. After your initial enrollment period or open enrollment period is closed, the Start Enrollment button is no longer visible. If you no longer see this button and you have not yet enrolled, this most likely means that your 30 days to enroll are up. Please contact me as soon as possible for assistance. There are a total of 10 steps to complete your enrollment. After completing each step, click the Next button in the top right corner. The website has built-in error catching, so it will warn you if you are missing items. It does save periodically, so you can always come back to a step to complete it. There are multiple documents that you must open to review. Each will change from review required to completed, and a check mark will appear once you've read them. It's important to read these notices and email elizabeth.sullivan@swwc.org if you have any questions. The member communication is an annual update from Blue Cross Blue Shield that explains any changes that have been made to the benefits provided or other insurance-related items, such as maximum HSA contribution levels. The Children's Health Insurance Program notice tells you where to get more information about medical assistance if you have kids and cannot afford to take family health coverage. The Department of Labor and MNsure Notices of Exchange are required notices to inform you about the Affordable Care Act and exchanges where you can purchase coverage if you cannot afford your employer's coverage. However, since at least one single plan for each bargaining group is fully paid for by SWWC, none of our staff qualify for subsidies. The HIPAA Notice of Special Enrollment talks about your enrollment rights due to qualifying events throughout the plan year. The Prescription Drug Creditable Coverage Disclosure informs you that our coverage is considered creditable. Should you need to apply for Medicare, they will require this notice. The EaseCentral website will update your total cost per pay period based on elections you select. For each benefit type, you'll want to enroll or waive yourself and any dependents if applicable. You are required to enroll in at least single health coverage if you do not have other group health coverage. You will not be able to waive individual life and LTD coverages as they are mandatory plans. Each type of benefit has document links that you can click on to view the summaries of the benefits and coverage. If you elect the HSA health coverage, you will have the opportunity to elect an HSA contribution to be deducted from your paycheck. Keep in mind that this line is for an annual contribution, which will be evenly distributed over your paychecks for the year. If you wish to make changes to this election, which you can do up to monthly, please fill out an HSA election form on AppleTrack. You will not be able to sign your forms until all missing information is complete. Also, your enrollment is not finalized until you have signed your forms. You must complete all 10 steps, including reviewing the required documentation and signing the application before you can be enrolled in any insurances. So it's very important that you complete all of these steps within 30 days of hire or 30 days from your qualifying event. If this is not done within the 30 days, you will have to wait until a new qualifying event occurs or open enrollment, which is July 1st of each year, before you have the opportunity to enroll again. You can print a summary of your enrollment once you've signed. You will also receive a confirmation email. You can always log into EaseCentral to view your enrollments if you do not have access to this summary or email. There are other documents made available in the document library that are not mandatory to review, but are helpful with your insurance decisions or completing enrollment. These include the Blue Cross Blue Shield Health Plan Comparison, which compares the health plans that are offered, the Estimated Employee Insurance Cost per Paycheck spreadsheet, which shows the cost per paycheck of each plan offered, the Evidence of Insurability form, which is a required form for those newly enrolling for dependent life insurance that are not within their 30-day new hire eligibility window, the HSA application, which is required for those newly enrolling in the HSA plan to set up their HSA account, and the VEBA and HSA decision guide, which compares the differences between the VEBA and HSA accounts, as well as explains fourth quarter carryover and embedded deductible. If you have a qualifying event occur, such as detailed earlier, marriage, birth, or other, you would also use EaseCentral to make the appropriate changes to your coverage. To do so, click Manage Benefits and then Make Changes. Select the corresponding event, the effective date that the coverage should start. For example, if you lost other coverage on October 31st, you would enter October 31st and your new coverage would start on November 1st. With the birth of a child or marriage, put the date that the event occurred and coverage would start that day. Also enter appropriate details that will help explain the qualifying event if need be. Then click Continue to make your corresponding election changes. It is a good idea to double check with me after you've completed this process to verify that you've submitted everything correctly in order for the qualifying event change to occur within your 30-day election window. Throughout this webinar, I will be referring to the Employee Portal, which is an employee-only access section of our SWWC website that has countless resources, including newsletter archives, educational handouts, how-tos, forms, and more. Sections include benefits, calendars, committees, communications, directories, discount programs, employee evaluations, forms, insurance information, mentor program, payroll, policies and manuals, resources, technology resources, and wellness. The home page of the portal can be accessed without signing in, which includes links for SmartER, where you can view your pay stub, Time Clock Plus, where you can view or enter timesheet information and leave requests, and more. To sign in to view the rest of the resources, click User Options and then Sign In. Your username and password are the same login as what you use to access your email and to sign on to an SWWC computer. During this section, I will explain our health insurance plans. The Blue Cross Blue Shield plan comparison is available on the health insurance page of the employee portal, as well as on EaseCentral during your initial new hire enrollment process and during each annual open enrollment, which is held in May of each year and is effective with our insurance renewal on July 1st. The important thing to remember is that with our health plans, the coverage is identical no matter which plan you choose. The differences between them are the account that goes with the plan, the deductible, and the premium. Every covered expense, including prescriptions, goes toward the deductible. Our plans are all 100% plans, meaning that once the deductible is met, the insurance pays for all eligible expenses. The exception to this is if you go out of network, when you are then subject to pay 20% of those claims up to the out-of-pocket maximum, at which point the insurance resumes paying 100% of claims. There are two exceptions to this that I will explain along with the next two slides. Preventive items are covered at 100% upfront with no deductible. To see a list of what is considered preventive, check out the health insurance page of the employee portal. The VEBA 833 plan and the CDHP 860 plan both have the FlexRx prescription formulary. The CDHP 850 plan, which is the $5,000 deductible plan, has the GenRx prescription formulary, which is a little more restrictive in requiring generics for your prescriptions. Since these lists sometimes do change each plan year, the main thing I want to point out is at the bottom, which is the instructions for how to look up your prescriptions to see if they are on a specific formulary list. Once you are on Prime Therapeutics page, the pharmacy benefit manager for Blue Cross Blue Shield, select your appropriate formulary list and search for your prescription. You can also view alphabetic lists, updates, and more. To look up network information about doctors, clinics, etc. at mybluecrossmn.com, select the Aware Network under the Find a Doctor search. I do want to mention that this is not to say you will be required to take generics. If a certain generic doesn't work for you, there is still a process that you and your doctor would follow to try alternates, and if none work, a brand name could still be prescribed. If you have more questions on that process, please contact your doctor or Blue Cross Blue Shield. The VEBA and HSA Decision Guide is one of a couple different handouts that explain the differences between the VEBA and the HSA. I will explain the differences shortly. The handout also talks about embedded deductible, which means that one person in your family only has to meet the single deductible before the health insurance covers them. They do not have to meet the entire family deductible. Then the rest of your family members share what's remaining of the family deductible, and once that is met, all family members are covered by the health plan. All deductibles are calendar year for our plans. The other term I want to mention is fourth quarter carryover, which means that anything that is applied toward your deductible in the fourth quarter of the calendar year, October, November, and December, counts toward that year's deductible and is also carried over to the next year's deductible. For example, if you're healthy all year long and only used your insurance for preventive items, but had a skiing accident in December for which you paid $2,000 toward your deductible, you will also have $2,000 met toward your next year's deductible. Keep in mind that this is only for claims applied to your deductible. So if you met your deductible in June, for example, but still had medical claims in the fourth quarter, those expenses were paid for by the health insurance with no cost to you, so there is nothing to carry over. It is based on when the claims were incurred, not when you paid for them. The CDHP 850 plan, the $5,000 deductible plan, is the only plan that does not have this option. Here is another handout comparing the two types of accounts. HSA stands for Health Savings Account, and VEBA stands for Voluntary Employees Beneficiary Association. Both of these accounts are tax-free, meaning that all employee contributions are done on a pre-tax basis, all employer contributions are not taxable income, and any interest earned on the funds in the accounts grows tax-free as well. These accounts both roll over from year to year, transfer with you after your employment ends, and there is no use it or lose it provision like there is with a flexible spending account or FSA. Here are the differences between the VEBA and HSA. The VEBA can only be funded by the employer. SWWC contributes $50 per month toward single coverage and $100 per month toward family coverage for the VEBA 833 plan. The HSA can be funded by the employer, the employee, or both. I will talk about the contributions for the CDHP plans 860 and 850 later on. VEBA funds can only be used for what are called Section 213D eligible expenses, which include anything that is applied toward your health insurance deductible, as well as dental and vision expenses. The HSA funds can be withdrawn for any use, but if you use the money for anything that is not a Section 213D eligible expense, you will have to pay taxes on the money withdrawn, as well as a 20% penalty. If you withdraw for ineligible reasons after you turn age 65, you will still have to pay taxes on the funds withdrawn, but the penalty is waived. With the VEBA, you must prove any withdrawals are for eligible expenses prior to receiving the funds. With the HSA, you can withdraw funds at any time, but you must save your itemized receipts and other supporting documentation to prove that the withdrawals were for eligible medical expenses in case you are audited. The VEBA has what is called a coordination of benefits, which means that if you elect to put pre-tax dollars into a medical flexible spending account, or FSA, claims are all paid with the FSA first, since that has the use it or lose it provision. After your FSA funds are exhausted, any remaining claims will come out of the VEBA. With the HSA, there is no coordination of benefits unless both the employee and spouse have plans that are both HSA qualified. If you or your spouse contribute to an HSA, you can only set up an FSA for dental and vision expenses, which is called a limited purpose FSA. You would use your HSA funds for any medical expenses. While your HSA funds can also be used to pay for dental and vision expenses, a couple of reasons one may choose to do this are if they know in advance that they'll need their full HSA contribution for medical expenses, or if they would prefer to save all of their HSA funds for future expenses, but in either of those cases also know that they have foreseeable dental and/or vision expenses. The VEBA can be used to pay for post-employment insurance premiums such as COBRA premiums at any age, including early retirement. The HSA can only be used to pay for Medicare's Part B and D and Medicare Advantage and cost plans after reaching age 65. Beneficiaries are also set up a little bit differently. With the VEBA, your medical dependents are your primary beneficiaries, and then you can designate other beneficiaries if you have no medical dependents or to set up contingent beneficiaries. This account becomes a taxable event to anyone who is not a medical dependent. With the HSA, you can designate anybody as a beneficiary. If your spouse is designated, it will become their HSA upon date of death. If the beneficiary is anyone other than your spouse, the account ceases to be an HSA and becomes taxable gross income to the beneficiary in the year of death. These two accounts are set up with different legislation, so if you switch health plans at open enrollment, the account associated with your new health plan is the active account, and the other must become a limited purpose account for dental and vision only. Dollars cannot be rolled from one account to the other. Both of these accounts may also be locked if you wish to have no claims paid from them in order to save funds for future future medical, dental, and vision expenses. You may also invest in mutual funds after you have a balance of $1,000 in your account, and you may receive a brokerage account with Charles Schwab representative assistance after you have $10,000 in your account. Visit hellofurther.com for more information. On the insurance page of the employee portal, under Further Educational Material, you can view a variety of other resources that further explain VEBAs, HSAs, and more. This spreadsheet shows an example of the cost per plan by bargaining group. The spreadsheet gets updated each year and can be sent to you for your specific group, so it's not as difficult to read as this agency-wide version shown. Please email me if you'd like a copy. When you go through the EaseCentral enrollment process, it will also update based on your plan elections what your per paycheck cost will be. All groups have at least one 100% employer-paid option for single coverage. Please note that there is an administrative fee that Further, who processes all VEBA, HSA, and FSA claims, charges per month. This fee is the same no matter how many of these different accounts you may have, and it is deducted from your paychecks on a pre-tax basis, as are all of your insurance premiums. Here is an example of the bargaining group specific insurance paycheck deduction spreadsheet. It also has scenario comparisons to assist you in choosing the best plan for your family. While the deductibles do vary between the plans, the premium savings and contributions do make the plans more similar in total cost. In this example, with the VEBA 833, the current deductible is $2,600 for single coverage, and there is no premium cost to the employee. Since SWWC contributes $600 toward the VEBA, there is $2,000 remaining that the employee must be responsible for should they meet the full deductible. Best case scenario, they have no deductible met and a savings of $600 in their account. This is the case for all single VEBA 833 plans regardless of the bargaining group. In this example for single coverage under the CDHP 860, there is again no cost for the premium to the employee, and the single deductible is $3,375. The negotiated contribution toward the account for single coverage is $906, leaving $2,469 for the employee to be responsible for should they meet the full deductible. Best case scenario, they have $906 in savings in their account. In this example for single coverage under the CDHP 850, there is again no cost for premium to the employee, and the single deductible is $5,000. The negotiated contribution toward the account for single coverage is $1,812, leaving $3,188 for the employee to be responsible for should they meet the full deductible. Best case scenario, they have $1,812 in their savings account. For family coverage, the VEBA 833 costs $4,219 in premium to the employee with a $5,200 deductible. Since SWWC contributes $1,200 toward the VEBA account, the employee would be responsible for the remaining $4,000 in deductible costs. So in the worst case scenario, their total cost for a year would be $8,219. If they did not meet any deductible, they would still have the cost of $4,219 in premium, and then they would have a savings of $1,200 in their account. If one family member meets the deductible, they would again have to pay for the $4,219 in premium, but only $1,400 of the $2,600 single deductible, for a total annual cost of $5,619. Family coverage under the CDHP 860 costs $2,407 in premium with a $6,750 deductible. Since the employee can put money into an account under this plan, SWWC applies the $1,200 account contribution toward the premium instead to help make it more affordable. Therefore, there is no account contribution for family coverage under this plan, and the employee is responsible for the full deductible cost. In the worst case scenario, their total cost for the year would be $9,157, which is the total premium that the employee is responsible for, plus the total deductible. If they did not meet any deductible, they would have a total cost of $2,407 for the premium alone. If one family member meets the deductible, they would have to again pay the $2,407 in premium, but only the $3,375 single deductible for a total annual cost of $5,782. Lastly, family coverage under the CDHP 850 in this scenario is free, as the total SWWC contribution is higher than the family premium. The remaining $191 of the total contribution then goes toward the account the employee selects. In the worst case scenario, the total cost for a year would be $9,809, the $10,000 deductible less the $191 account contribution. In the best case scenario, where they do not meet any deductible, they have an account savings of $191. If one family member meets the deductible, their total cost would be $4,809, which is the $5,000 single deductible less the $191 account contribution. These examples only show account balances for 1 year. If there are previous savings in the account, or if you have an FSA in addition to your VEBA that is not limited purpose for dental and vision only, these would also help offset any cost should you have any deductible expenses. This handout from Further and the Minnesota Healthcare Consortium explains your options with our CDHP plans 860 and 850. Each employee enrolled in either the CDHP 860 plan or the CDHP 850 plan will have the option to choose where their employer contribution is submitted. There are 3 options: 100% to a VEBA, 100% to an HSA, or a 50% split to both accounts. This flowchart shows how your selection affects your accounts and/or additional contributions. If you choose to submit your employer contribution 100% to the VEBA, you can choose whether or not you wish to also contribute to an HSA. If you do not want to contribute to an HSA, your VEBA can either be frozen for future medical expenses or active to be used for your current medical, dental, and vision expenses. You may also elect contributions towards your medical flexible spending account, or FSA, to pay for these items. Remember that everything will be paid for out of your flex first, since that's use it or lose it, and once your flex is exhausted, claims would be paid from your VEBA, since that rolls over from year to year. If you choose to also contribute to an HSA with the 100% VEBA option, you will need to either freeze your VEBA or have it be set as a limited purpose account for dental and vision expenses only. You can then contribute up to the IRS maximum for your HSA. If you choose either of the other 2 options, where all or half of the employer funds are going toward your HSA, your VEBA must be either frozen for future expenses or set up as a limited purpose account for dental and vision expenses only. You may then contribute to your HSA up to the maximum allowable contribution limit, less any employer contributions. This maximum allowable contribution is a calendar year limit, since it is associated with your tax return. To see the most recent IRS maximums, visit the health insurance page of the employee portal. You may also elect contributions toward your medical FSA, but it can only be used for dental and vision. Your HSA is the account that will be used for any medical out-of-pocket expenses. You can freeze your VEBA at any time with the VEBA account option form available at hellofurther.com. So what are some reasons why a person would take advantage of this combo plan? Here are a few I can think of, but this list is by no means all-encompassing. Number 1, VEBA can be used to pay for early retirement insurance premiums pre-age 65, where the HSA cannot. Number 2, you want to maximize the amount of funds you have for future medical expenses. If you elect 50% or 100% of your employer contribution go to the VEBA instead of 100% to the HSA, you can contribute that much more toward your HSA. Number 3, you want to have your employer contribution submitted to the VEBA, but prefer to have a higher deductible in order to save premiums. And number 4, you want to have employer funds go to the VEBA so that it coordinates with your spouse's insurance better, as VEBA and HSA plans are not completely compatible with double coverage. If you find yourself in that unique situation, please contact me to explain how the accounts coordinate and to assist with your decision. If you enroll in the VEBA, your account is automatically set up with no additional information required from you. However, if you will have any HSA contributions, either employer funded or by your elected contribution, you will need to complete the HSA application to get your account set up. This can be found on EaseCentral in the documents or on the employee portal. Please return this form as soon as possible. It can be faxed, mailed, or emailed to me. Keep in mind that SWWC's emails are secure to each other, but you should never use your personal email account to send confidential information such as your date of birth or social security number. During the EaseCentral process, you will have an opportunity to make your initial HSA election. This can be changed up to monthly by completing the HSA Employee Contribution Election Form, which is available via AppleTrack. Instructions for AppleTrack employee forms are available on the Forms page of the employee portal. You can also contribute to your HSA outside of a payroll deduction by withdrawals from your checking or savings account, sending in a check, or as part of your tax return process. While there is a maximum contribution that can be made each tax year, the contributions towards the previous tax year can be made as late as April 15th. You will automatically be enrolled in Crossover unless you elect otherwise. Crossover is the automatic reimbursement feature of your accounts. The way that Crossover works is if you go to pick up a prescription, they will look up your insurance card information, see that you have an FSA, VEBA, or HSA, and automatically draw any funds available up to the amount of your total cost, so that when you pick it up, you only have to pay any remaining balance or nothing at all if you have enough money in your account to pay for it. There are then no claim forms to fill out. It is similar if you visit a clinic or hospital, except that after the explanation of benefits, known as an EOB, is processed, you will automatically be reimbursed for the amount that you owe for the services after all of the Blue Cross Blue Shield adjustments with the provider have been made. You will then pay the provider with these funds when you receive their bill. This process saves on paperwork and filling out claim forms. As a reminder, if you take advantage of Crossover, please sign up for direct deposit in order to expedite your reimbursement. This may be done on Further's website or by completing an authorization for direct deposit form. This is separate from your payroll direct deposit and is available on the employee portal. An alternative to Crossover is to sign up for a debit card. This can be done on Further's website or by completing a debit card participant request form available on the employee portal. You can then use this debit card to pay for any medical, dental, or vision expenses as the bills are sent to you. Here's the contact information for Blue Cross Blue Shield of Minnesota, as well as Further, the company that administers the FSAs, HSAs, and VEBAs for SWWC and Blue Cross Blue Shield. All resources discussed about health insurance can also be found on the insurance page of the employee portal at www.swwc.org/insurance. In this section, I will explain our other benefits and insurance offerings. SWWC offers many other benefits and insurance offerings besides health insurance. For anyone who is half-time or more, you may participate in our flexible spending account plan. More information will be provided about this shortly. If you are eligible for all benefits, you are provided with life and long-term disability insurance. Each bargaining group has a negotiated life insurance benefit, which is listed on their summary of benefits. There is also the opportunity to elect voluntary life insurance on your dependents, including spouse and unmarried children up to the age of 25, at a cost of $3 per month. Those eligible for all benefits are also able to enroll in our voluntary dental and vision coverages, which will be explained in more detail later. Two other benefits that are tied to healthcare are Vitals and Doctor on Demand, which were explained earlier, as was the 403B benefit, liability insurance, employee discounts, and the EAP. While the 403B is an optional retirement savings vehicle, TRA, which stands for Teachers Retirement Association of Minnesota, and PERA, which stands for Public Employees Retirement Association of Minnesota, are both mandatory retirement plans set up for school district employees. All of our staff, as long as they meet the earnings threshold, must be enrolled in one of these two plans. There is no opting out. TRA is for all positions requiring a Minnesota teaching license, as well as a few other positions that require licensure or certification, including audiologists, occupational therapists, physical therapists, board-certified behavior analysts, and mental health professionals. All other positions are enrolled in PERA. For more information on your retirement plan, visit minnesotatra.org or mnpera.org. Personal leave and sick leave are PTO or paid time off benefits available to those who qualify. Sick leave can be used for your own illness or doctor or dentist appointments that cannot be taken care of on non-scheduled work hours, as well as those same reasons for your dependent children. After you've been employed for a year, you may also use your sick leave for other family members as designated by a Minnesota statute. Bereavement leave of up to 5 days per circumstance for immediate family members also comes out of the sick leave balance. See the leave code handout on the payroll page of the employee portal for more details about which leave codes to use for each reason. Personal leave is intended to be used for any personal business that cannot be conducted outside of normal work hours. It is not vacation. Those who have snow days that are not made up at a later date may also use personal leave to make up for time missed. Other PTO benefits that are bargaining group specific are annual leave, holidays, and emergency closing leave. Emergency closing leave, available for direct student staff only, is used for any late start or early out as determined by the Educational Learning Center site administrator. Whole days missed do not qualify for emergency closing leave. Each of the insurance types that we offer has its own employee portal page that contains contact information, forms, plan comparisons, summaries of benefits and coverage, plan booklets, and more. The health insurance page also has mandatory notices, eligible expenses lists, preventive care guidelines, and network information. SWWC offers flexible spending accounts, abbreviated as FSAs, as a benefit. These accounts allow you to put funds away pre-tax to cover eligible dental, vision, and medical expenses applied toward your deductible, as well as dependent care, which is to pay for daycare expenses. Additional information on our FSA accounts can be found on the employee portal. It is extremely important to remember that with FSAs, the funds do not roll over from year to year. Whatever is not used at the end of that benefit year, the employee could lose. Our FSA plan is our fiscal year, which is July 1st through June 30th. Expenses must be incurred by June 30th, though you do have until September 30th to submit them for reimbursement. Please also remember that those who have contributions toward a health savings account can only have a limited purpose medical FSA, which may be used solely for dental and vision expenses. These handouts are instructions for how to register for My Blue Cross and further. If you enroll in the health insurance and/or an FSA, these are important tools for you to sign up with. The My Blue Cross portal allows you to see your claims, deductibles, and out-of-pocket maximums, see your HSA, VEBA, and FSA account balances, find a doctor in your plan's network, see special programs and discounts available to you, see your prescription drug information, access your member ID card, and find forms. The Further portal allows you to see your HSA, VEBA, and FSA account balances, as well as any investment balances, including contributions and withdrawals. You can submit claims and make deposits on the site, sign up for or change your direct deposit information, sign up for a debit card, and view educational resources. This is also where you would start the process to invest your funds once you reach the $1,000 balance in your VEBA or HSA. There is also a tool called My Records and Receipts where you can upload, store, and organize your electronic records to save for audit purposes. These how-tos can also be found on the employee portal and your new employee flash drive. SWWC offers voluntary dental insurance to those who are eligible for all benefits. The Pathfinder dental insurance is through Delta Dental. When enrolling on EaseCentral, you can view the most up-to-date versions of the plan coverage summary. The summary lists what services are covered and the percentage of cost covered. Some services will be paid out at different percentages based on whether it is in-network or out-of-network. You can go to any provider that you like, but if you go to a Delta Dental provider on the PPO or Premier networks, your dollars will go further as those providers have agreements with Delta Dental as to the maximum amount they can charge for each type of service. Plan year maximums are per person maximums, so if you enroll in family coverage, each person gets up to that amount of coverage. Deductibles are capped at 3, so if you have a family of 4 or more, you still only have to pay 3 deductibles, which are on a calendar year basis. The insurance only provides for white fillings on the front teeth. You may choose to get white fillings in all of your teeth, but you will only be reimbursed the cost of the silver fillings for your back teeth. The oral surgery covers only simple things that the dentist can do, not any major surgical. There is also a children's orthodontia coverage with this plan for those between ages 8 and 18, capped at a $1,000 lifetime maximum. Dependent children can be covered on this dental plan until they reach age 26. We also offer voluntary vision insurance to our employees through Emeritus Group. Eye exams are covered under preventive care with your health insurance. This optional insurance is to help offset the cost of purchasing glasses or contacts. There are two plan options, a low plan, where you can go to any provider you want, and a high plan, which has a network. This network can be found at emeritusgroup.com. You only receive an insurance card with the low plan. With the high plan, the network provider can look you up in their system to process your claim. If you go to an out-of-network provider, you would fill out the VSP out-of-network vision reimbursement form available on the employee portal. If you choose the low plan, frames are $100 and lenses are capped at different amounts based on the type of lens you need to purchase. Contacts are reimbursed up to $140 per year. If you choose the high plan, reimbursement levels will depend on if you visit a network provider or not. Deductibles are also listed on the overview sheet. If you choose the low plan, there is an additional discount provided if you visit an EyeMed provider. The way that this works along with the insurance is if you are purchasing single vision lenses for your glasses, for example, and they normally would cost $80, those lenses are discounted to $50, and then the insurance would pay $40 of that $50. There is also a discount toward LASIK surgery with EyeMed discount. Each year, you are only reimbursed for glasses or contacts, not both. So you'll want to keep that in mind as you review the coverages and making determinations as to which, if any, you'd like to elect. As previously covered, Blue 365 Deals provides discounts on fitness centers, healthy eating, LASIK surgery, heart monitors, hearing aids, and more. Omada is a digital lifestyle change program that inspires healthy habits that last. It combines the latest technology with useful information and ongoing support from a health coach, an approach shown to promote weight loss and reduce risk for type 2 diabetes and heart disease. Individuals can find out if they're eligible for the program by taking a 1-minute risk screener at omadahealth.com/MHC. Those who do qualify will receive a scale, can use a web-based system or app to input their information, have a coach and accountability team, can sync reporting with their Fitbit or similar device, and if they do not have such a device, will receive a pedometer. This is now being offered at no cost to those enrolled in our Blue Cross Blue Shield health insurance. See the brochure for more details. Doctor on Demand is another great way to make your FSA, HSA, and or VEBA funds last longer. It's a great way to reduce utilization costs versus a clinic visit. You also save time not sitting in a waiting room with other sick people when you visit a doctor from the comfort of your own home or from the office. You can do this by a smartphone app or using your computer and a webcam. Connect with a board-certified and state-licensed physician, typically within 90 seconds. You can also set up an appointment for a time that's convenient for you. If a prescription is written, quick and paperless fulfillment is sent to your pharmacy. A summary of your visit can be provided so that you can give your records to your primary physician. Mental health visits are also an option. Fees are applied toward your deductible, and crossover or debit card features work to pay the bill. See more about Doctor on Demand at swwc.org/doctorondemand. Vital's Smart Shopper is a healthcare shopping and savings program that works with your medical benefits. With Smart Shopper, you and your covered family members shop for different medical procedures and tests via phone, web, or mobile device. When you choose to have your procedure at a facility on the Smart Shopper list, you earn cash. You also save money on what you pay for the out-of-pocket price for the procedure. You can search and compare prices for office visits, lab tests, prescription drugs, and more. Register by calling the Smart Shopper Personal Assistance Team at 1-866-285-7452 or go online to bcbsmn.com www.vitalsmartshopper.com. Trig is an educational tool to assist you in becoming more educated in the healthcare system. You will receive monthly newsletters and login credentials to a website with a variety of tools, including deeper dive questions such as when and how to get a second opinion, the art of questioning your healthcare provider, and more. This was a lot to learn, and insurance is a complex system, so please feel free to contact me with any questions you have about any of the information you have heard in this webinar. Thank you for your time and have a wonderful day.